Well, let's bring you a little bit more on the latest COVID data. The REACT-1 team from Imperial College, London, now completing the latest round of their study, looking at the prevalence of the virus across the country. We're joined now by Professor Paul Elliot, Director of the REACT programme and Chair in Epidemiology and Public Health Medicine at Imperial College, London. Great to see you this morning, Professor. It is, again, a fascinating piece of research. Let's start with that which everyone has latched onto. How much more do we know about Omicron?
Well, what we've seen in our data is that we've had, since the summer, really quite high prevalence, but pretty steady, with the R number around 1. But from the beginning of December, we saw this very dramatic rise in prevalence across the country, but particularly in London, with the R number now substantially above 1. So this exponential increase in infections, which is absolutely being driven by the Omicron variant.
Just in terms of what that means in terms of the public health strategy, in terms of the pressure on the NHS, you will have seen, I'm sure, some of the front pages this morning and everyone focusing very, very quickly on the fact that it certainly appears that this is significantly less severe, that there is a reduced chance of hospitalisation as a result. I mean, how confident are we in that?
Well, of course, that's encouraging news, that perhaps the infection, when you get it, might be less severe in terms of hospitalisation. But of course, with this very, very rapid rise and increase in cases, and we've seen the national cases go above 100,000, then of course, more cases means more pressure, because if even though a smaller proportion might get severe disease or go into hospital, that could still result in many cases, and of course that could give pressure on the health service.
Of course, I mean, just very simply put, despite the fact that Omicron may prove to be significantly less severe in individual kind of health outcomes, that does not mean that the NHS will not be under huge pressure perhaps in a couple of weeks' time.
Absolutely the case, because this rise in infections, which we see in our data and is seen also in the testing data through the national routine testing of people presenting with symptoms, means that there are going to be, well, there are, many cases, and sadly some of those people may get severe illness and end up in hospital.
Of course, this data will assist other pieces of research, the modelling around COVID-19, and of course on the new variant. A number of people are suggesting that the SPI-M models were quite pessimistic. They would need to be revised on the basis of what you have discovered. Is that correct?
Yeah, I mean, what we're doing is we're looking actually in real time. So our data was up till the 14th of December, with some additional cases up till the 17th of December. And we're looking in the general population. So we take a random sample of the population of England and ask people to take part and give us a swab and answer some questions about their symptoms and so forth. So we get a really good picture of what's happening in the population in real time. And of course, that's extremely helpful. So we're not modelling forward, we're looking at what's happening in the here and now. And in the here and now, as I say, we've seen this very rapid rise in infections, which is being driven by the Omicron variant.
But of course, it will be a piece of research that the government would look at in terms of, plotting their strategy moving forward. I wonder, though, if we could just focus just for a second on children, the idea that 4.5% infected there compared to 1.5% nationally. Do we know why that is? Is it simply, the lack of vaccination?
Well, we have if you like, a sort of natural experiment, because the younger children have not been vaccinated. So this is the primary school age children, whereas the older children from 12 and above have been receiving vaccine, and in our data, certainly a good proportion of them have been vaccinated. And very interestingly, what we saw from our previous survey, which ended on the 5th of November, to the current survey, which was between the 23rd of November and the 15th of December, we saw a drop by about half of the infection rate in the older school children, but the youngest children that you're talking about, their prevalence remained about the same, about 5%. So we do see the real benefits of the vaccination programme in those older school children coming through in the data that we're collecting.
What does the research show about those who have yet to be vaccinated? We know that there are parts of London, for example, where perhaps as many as 40% of the population haven't had a single jab. There must be concern about what might be happening there.
Yes, certainly in our data, the really big rise in December with Omicron has been in London. It's sort of in the vanguard, if you like, of this variant. And of the 10 local small areas, lower tier local authority areas that we're monitoring, of the 10 with the highest, 8 of those are in London. So we really are seeing this in London.
Professor, just whilst we have you, I wonder if I might ask you to kind of remove your professorial hat just for a second. On the basis of the research that has been carried out, as we edge into 2022, past couple of years have been pretty rough for everyone. Are you feeling more or less positive about what might be coming down the track as a result of this?
To be honest, we're really quite positive about the rollout of the vaccine programme, which has been obviously a fantastic success. We are seeing that in our data, not only in the secondary school-aged children, but actually in older people over the age of 65. We've seen a real drop in infections in that group, again reflecting the booster programme, where most of those people have had a booster. So it was really looking promising. And of course, now we've got this variant and this very, very sharp rise in infection. So for the time being, I would say that we all have to be a bit cautious, and we have to pay attention to the public health message. We have to wear our mask and so forth, because these are unprecedented levels of infection.
They certainly are. Professor Paul Elliot, great to have you on the programme this morning, and a very Merry Christmas to you and yours when it comes.
Thanks very much. Thank you.